Welcome to the JOWMA podcast, presented by the Jewish Orthodox Women's Medical Association. Every week, hear from expert medical professionals as they share up-to-date insights on health topics to help you live your best life physically, mentally, and emotionally. Join us as we navigate the ever-changing landscape of healthcare and strive to improve the health of the Orthodox Jewish community.
Hi, I'm Rebecca Friedman. I'm a fourth-year medical student at New York Medical College, and I'm here with the JOWMA Specialty Spotlight podcast. The Specialty Spotlight podcasts are geared toward pre-med and medical students interested in learning about different medical specialties. Today, I will be talking to Dr. Mimi Knoll. Dr. Knoll is a co-founder and CEO of JOWMA and is a radiation oncologist at Northwell Health in New York. Dr. Knoll received her medical degree at New York University School of Medicine and completed her radiation oncology training at Mount Sinai Medical Center in New York. She serves as a section editor for the peer-reviewed Journal of the American Society of Radiation Oncology, Advances in Radiation Oncology, and is an active member with ASCO, ASTRO, NRG, and RTOG Foundation. Dr. Knoll is an international speaker and researcher focusing on the medical workforce, women in medicine, and social media in medicine. Dr. Knoll is a Forbes healthcare contributor and writes for the American Society of Clinical Oncology Connection and numerous other media outlets. You can follow her on Twitter at mknollmd and on Instagram at dr.mimi.k. Thank you again so much for being here, Dr. Knoll. We're so happy to have you. So just to get us started, the first question I want to talk to you about is, can you give us a little bit more information on your background, your path to medicine, like what led you to choose a career in medicine? And did you always know that you wanted to do radiation oncology, or did you have other things in mind?
Sure. So I grew up in a family of doctors. 3 out of 4 of my grandparents are Holocaust survivors. And when they came to the United States, like many other immigrants, they thought, well, my kids have to be educated, really important to get an education. And my mother, who's a pediatrician, still practicing in the office in the home where I grew up in Brooklyn. My dad is a vascular surgeon. He also, when I was a teenager, opened up an ambulatory surgery center also in the home where I grew up in Brooklyn. My uncle is a cardiologist. He also had an office in the home where I grew up in Brooklyn. So, and I also have another uncle. I have a cousin that's a doctor. So lots of doctors. So back to my mom, when, my mother grew up in Williamsburg. At that time, Williamsburg was not all Hasidish like it is now, meaning the Jewish community at that time was not as homogenous as it is now. And my mother to this day says she doesn't know how my grandfather, her father, decided that she needed to be a doctor, but that's what he decided. And therefore that's what she did. So it was super unusual then, of course. And it's always shocking to me how it's still unusual now, even with JOWMA, even with so many more women going into medicine. Some of the questions that I get asked, both personally and through JOWMA, I'm sure you'd agree, sound very similar to the questions I had and the questions that my mom had too. So we've come a long way, and yet maybe not as much as we would have hoped. So yeah, in the back of my mind, I always thought and knew, medicine's definitely a possibility. My parents love being physicians, have been in private practice, pretty much from day one. So they, were definitely very encouraging, but I sort of didn't say that's what I wanted to do because I just knew like, I'll figure it out when I get to college. So I went to CUNY, I went to Brooklyn College, took all the sciences, and was actually really considering staying and doing a PhD in psychology because I majored in psychology, or going to medical school. And again, my parents, who are, so happy with their career choices, community leaders, love being physicians, love helping patients. They were very supportive and said, no, like if you want to do psychology, then you'll become a psychiatrist, but, you should go to medical school, we'll help you, we'll support you, you should do it, even if you don't want to practice medicine. And in the idea that having the degree really allows you a tremendous amount of flexibility and opportunity in your career, which is the case, was the case when I was pre-med, in the early 2000s, and it's certainly the case now.
Absolutely. And it's amazing that you had so much support and, exposure, because not everybody has that opportunity. And I just want to, for the last part of the question, did you always know radiation oncology, or how was that journey coming to that?
Yeah, so I think that in general, it's a really good idea to do what you enjoy and to do what you like. But there are different types of people in their jobs, right? So medicine ultimately is a job, as much as it's so much a part of our identity. So it's something that when I mentor students and residents, I try to remind them that ultimately you are not your job. You are a person who has a job, and a specialty is sort of similar. You have to pick a specialty that you enjoy, but it's also going to be a job in that you show up every day and there's going to be things that you don't like and you don't want to do that you're just going to have to do. And some people, really are very excited about everything about their specific specialty. And other people are like, well, this is going to fit best with what I'm going to want to do every day. And either one of those things are okay. I would say I was more of the first kind of person in the sense that I was only willing to do a residency if I really was excited to do that specialty. And I sort of went through one clerkship at a time. At that time, NYU just had two, preclinical years and then two clinical years. So I felt like I didn't even have enough time really to think about it because I just went from one clerkship to the next. And
Yeah.
I kept going through one after the other. And I really hated everything. I really did not like anything. There's nothing that I thought, wow, I'm really going to enjoy doing this. And then I was like, well, why am I doing this? I had already had two children in medical school. I got married my first year of medical school. I took a year off when my oldest was born. So that was between my second and third year. So I was graduating medical school with two babies. And I thought, if I don't love anything, I'm just not going to do it. I'll just find something else to do. But then my father-in-law is a urologist and he met Dr. Gedgerman in Shul, who also lived in Passaic, and Dr. Gen and also met my husband. And basically between my husband and my father-in-law, who also did brachytherapy cases for patients with prostate cancer, the two of them said, we heard about this specialty. We know about the specialty. You're probably going to love it. So they were right. And I looked into it. And at that time, radiation oncology was very competitive. You kind of, go cyclical. So I really had to decide if I was going to put all my eggs in one basket. But honestly, just having a phone call and hearing about it, and then going to speak with some of the residents at NYU, I was like, you know what? This is what I want to do. And I was all in. I worked with Dr. Zalewski at Memorial Sloan Kettering, did research with him. And, that's the end of the story. I knew right away that I really was going to enjoy it. I really thought cancer was fascinating. Radiation the training itself is actually basically like 8 to 5, like the hours were not crazy. And then as an attending, almost all attendings have like one research day. That was like the way it has always been. It's still pretty much like that. So I really like the opportunity to do research and be an expert in a field. Working as part of a team was also something that I really enjoyed. So you have nurses, you have radiation therapists, radiation dosimetrists, physicists, other oncologists that you're working with. So it's a really collaborative specialty that I really, really liked. And that's it. I put all my eggs in one basket, set up all my rotation, set up my research, and thankfully matched.
That's amazing. I'm very happy for you. It sounds like you really enjoy what you're doing. So that's
Yeah.
always inspirational to hear. So kind of going a step back for a bit, what do you think for, people who are listening who are considering a path in medicine, what do you think it takes to pursue a career in medicine? And do you think there are any particular traits that are necessary?
Yeah, these are great questions. So I think that the most important thing is passion and commitment. Going to medical school and getting through training is extremely, extremely difficult. There's no other way around it. I know people throw the word trauma around a lot today, but I probably still believe that going through medical training is traumatic for everyone. Not necessarily in every single day, but there's just, you work with so many people in so many ways, and so many people have control and ability to ruin your career and your life, whether it's at a rotation, whether it's medical education. I mean, it's just really, really hard. If you think about, there's no other employee in the hospital that gets treated the way medical students and residents get treated. And even as an attending, it's hard. Way, way, way easier. Medicine is really hard. There's just so many challenges. So I strongly discourage it unless it's something that you are all in on, like 100% with every fiber of your body. You know that you only want to be a doctor and not anything else ever. And those are the only people that should pursue medical school. And those are the people that we help at JOWMA. right? Like we're not looking to recruit doctors ever, but we want to make sure that those young women and increasingly young men who also come to our events and join JOWMA, that they get the support that they need, because we want to make sure that the pipeline doesn't continue to be leaky, right? So we start off with a certain number of people that want to do it, and then the pipeline gets leaky. People start dropping off. They get really bad advice. They don't get in. They do the wrong things. And then, these are the doctors that we really needed to take care of us, right? To take care of the world, to take care of our community. It's a huge, huge loss. But again, unless you have that commitment and drive and persistence, that this is the only thing you want to do and you want to do with every fiber of your body, then just pick something else. Would you agree?
Yes, I absolutely agree with that. I think it is extremely difficult, one of the most difficult career paths to take, and the reward is very high in a lot of ways, but it's also financially very difficult. It takes away from family, from other things. So I think you absolutely need to be committed to it and know why you want to do it before you get started. So yes, I definitely agree with that. Okay, so going back to radiation oncology, can you take us through a typical day? I know you said you have like some research days, but maybe the clinical day or both. And then are there any misconceptions about the field that you wish people understood better? Especially it's not, I think, as well known as maybe some of the more popular fields in medicine.
Yeah, sure. So radiation oncology is a very tiny field. There's about 200 or so residents per year across the United
Wow.
States. So it's really, really, really tiny. And each person's job is obviously a little bit different. I would say my current job, I work at Northwell at LIJ in North Shore. My current job is quite unusual. I actually don't know anyone else who has the position that I have. I work part-time. Because I run JOWMA as a volunteer 24/7 the rest of the time. But I work 3 days a week at Northwell, and I cover only inpatients. So meaning individuals who have been diagnosed with cancer, who need palliative radiation for whatever reason. Maybe they have a brain metastasis, maybe they have a spinal cord compression, maybe there's an airway problem or bleeding of some sort, and I take care of those patients. So that's me, that's my position. But again, very different than what a regular, run-of-the-mill radiation oncologist would do. And a regular day for a regular radiation oncologist would mean seeing patients for consultation who have had a diagnosis of cancer already, meaning they're referred from someone, whether it's a surgeon or a medical oncologist who says, here's a patient that has cancer. I think they might need radiation. Would see them in a clinic setting, so outpatient, and then see, do I think they need radiation? How much? What kind? What are my recommendations? Then we would get the patient set up to have radiation. I would plan the radiation on the CAT scan that we did for each patient that comes in. Then we work with radiation dosimetrists, radiation physicists to make sure that the plan is good. Then we start the patient on radiation. I don't actually turn the machine on, right? The radiation therapists do that, but I oversee the treatment, see if they're having any side effects, things like that, and then see them in follow-up. So it's almost very much outpatient specialty, which is why the training is a lot easier. We are on call, nights and weekends, but, infrequently do you actually get called in, and you're only on call, like, let's say there's 8 residents, you'll be on call once every 8 weeks. So it's pretty much a Shomer Shabbos residency, even if it's not called that.
Also, I'm curious with your inpatient job, are those patients also going to be seen eventually by an outpatient facility, or is it like two separate?
Yeah, so it depends also like on their performance status. Like obviously, if a patient's going on hospice, they're not going to follow up with us. But for the most part, they tend to follow up with someone else that's part of my department, especially if they're going to need additional radiation. But they also have like their main oncologist who's taking care of them, who really coordinates their care.
Makes sense. Okay, so taking a little bit of a different thing, you mentioned co-founding, JOWMA, and obviously you have a huge role in there. I would love to hear more about so far how it's been so successful. What do you see for the future, and what are some things that have surprised you about this journey along the way?
So starting and running JOWMA has been really just an unbelievable experience. It's been a real opportunity to give back to the world and to support hundreds of young women and physicians like yourself who, are able to do really cool, amazing things, whether in leadership positions, whether by giving back. You know, sometimes people, they don't know what we are or what we do. And then when they join, they're like, oh, now I get it. Now I get to
Yeah.
do more. I
Yeah.
thought I was busy. And yet everyone else, all the other, over 800 members are just as busy. And everybody just wants to help each other, make the world a better place, whether it's volunteering to mentor, whether it's volunteering on a committee and helping to combat misinformation from community. There's so many ways that JOWMA is making a difference in a way that really just didn't exist before we started JOWMA. I mean, if you would have told me when I started it 6 years ago that we would be where we are today, I certainly would not have believed you, because I didn't even see what the real need was until we started it. And then my role has always been and continues to be to create a structure to support our volunteers and the work that you want to do in the world, right? So, you want to host a podcast. That means, I got to create a podcast to provide you with this opportunity to volunteer, right? I mean, you're not getting anything out of it except that you want to make the world a better place. You want to help other people. So how could I say no to that, right? So anytime I think, oh my gosh, wow, this is a lot of work. And it is, it's nonstop.
Yeah.
I think, but everybody else wants to do more. So I have to do everything that I can to help other people make the world a better place. So our real strength are our members, our volunteers, again, people like yourself. You're busy. You don't have to be doing this. You don't have to be, doing a podcast and spending time and figuring out what questions to ask and coordinating and inviting people. These things are a lot of work. We have amazing staff behind the scenes that also support our volunteers and help our volunteers do what they want to do. And I think what's the biggest shocker is also how people in the community come to us now and ask for our help. They want to volunteer. They want to be part of what we do. And these are women and men who are not doctors. And they come to us saying, you guys are doing amazing work out there in the community, hosting educational events, working with government, combating anti-Semitism, combating misinformation, providing leadership opportunities for women in the frum community. We're doing things that nobody else is doing. And that's why people come to us and they say, please work with us. We want to host an event with you. We want to help you apply for this grant. I want to introduce you to these people. And that's also honestly how we've been able to grow. People coming to us saying, you're amazing. We want to help you do this. You're amazing. Can you help us do this? And that's why we are where we are.
It is pretty incredible just seeing, first of all, like all the different members and how each person does so many things. It's very inspiring to see how many hats everybody wears and everyone's so successful. It's incredible. And then also seeing how JOWMA does both like the pre-med stuff and helping med students, residents, members, as well as the community outreach. There's just so much that gets done. And it's honestly, it's very inspiring all the time. And we're all very grateful, all the members, for everything that you guys accomplish. And I do want to just touch on, is there anything you see for the future, any particular goals, or do you just hope to expand your reach?
Yeah, I mean, our goal is to continue doing what we're doing. I would say in the current way and also on a larger scale. There are probably people that would want to join JOWMA that may not even know that we exist because we have grown 100% organically. So the challenge and opportunity is, how do we continue to do what we're doing both for the community and for the medical community and integrate those two things, So we are a non-for-profit, and we have staff and we have grants and responsibilities and relationships and people that come to us and ask us, please help us with this, please help us with that. How do we continue to meet those needs while also helping our members in the best way? Because ultimately at our core, that's who we are. We started as a way to support and mentor current and future Jewish women physicians. And that's always going to be our number one goal. And I think, we've seen that the more that we support our members, the more our members want to do for the world. And I agree, that's the most inspiring thing of all. The fact that women who are so busy, have no time, are succeeding in their careers, not necessarily because they're frum, but despite the fact that they're frum. I mean, independently, right? Like, how many of our members are just killing it out there? I mean, they're just, internationally recognized physicians, and they just happen to be from, I mean, certainly if you dig down, that, commitment to community service, to giving back to the world, these are certainly from Torah concept. But the point is they're out there in the world accomplishing it. And it's not that anybody's picking them for opportunities because they're from. They're doing it despite the family obligations, right? Despite their religious obligations. So I agree that that is the most inspiring thing.
Yeah, absolutely. And being from is amazing, but it also does not make your career easier, I don't think, in any way. So it's really
Absolutely.
inspiring to see. Kind of shifting on that note, how have you managed the demands of your training, your career, all the things that you're doing while maintaining your well-being, life at home, religious life, all of that?
So I really don't believe in work-life balance. I don't, think that that's a helpful concept. I think everything you do in your life, you should do because you want to. And yeah, when you wake up in the morning and it's like, oh, I have to go to work, I have to go to residency, there's a part of that that's true. You do have to, but it's really more you want to. I want to get up and go to my residency program because I want to finish. And if I don't, they're going to fire me. Right. But in that moment,
Yeah.
you still want to. Right. So I think it's really, really important to think about your life as a whole and what is it that's important to you. And at any one moment, you may not want to do that one thing, but you're doing it overall because it's what's important to you, whether it's raising children, getting married, hosting for Shabbos, spending time with friends, your career. These are all things that are important to you. How would you decide what's me time versus your time versus family time? Is going to work me time? You could call it me time, right? You could also call it, an obligation or responsibility for your family. A lot of our members are the breadwinners in their families, or certainly, bringing in an income that's important to sustain the family. So, how do you decide what's me versus you? I just really find it an unhelpful concept. So I instead really encourage people and myself as well to really think about what's important to you. What are you going to look back on in 5 years and 10 years and say, I wish I did that? What are you going to wish that you did? Are you going to wish that you spent more time with your family? Are you going to wish that you invested time with your friends? Are you going to wish that you just pushed ahead past your perfectionism and got that research done? Whatever it is, what are you going to regret not doing? And do it now. Make a plan to get it done.
Yeah, I absolutely agree with that. It's a great reminder, especially now gearing up for residency applications and, ranking places and all of that. People talking about really, focus on what do you really want instead of all the outside pressures that are, around and trying to just, hone in on that. And I think that is very motivating and a good reminder. So
Yeah.
thank you.
Yeah. And you have to very often force yourself to do things that are important to you that feel impossible and overwhelming in the moment, So whether it's working out, finding a friend to, your workout buddies, or getting a trainer, if you're at that point in your life where you can do that, or, whether it's going on dates or having children, or there's so many things that are important that, especially as a trainee or as a doctor, are very overwhelming because they're time consuming and they're hard. And it's very easy to push it off and say, I'm not ready for that. I don't have time. But you're never going to have time. You're never going to. You're always going to be busy. And it's honestly, it's the same thing if you're not a doctor. I don't know anybody that's not busy. I'm sure all your friends, everyone's busy. Everybody says they're busy. Everybody is, there's just so much, in our modern lives, and things are just not going to happen on their own. So if you want something to happen, you have to make the time for it. My strategy is putting it on my calendar, and if it's on my calendar, I know it's going to happen, and that's it.
I agree
Push
with
through.
that. I agree. And that's, again, very inspiring to hear. So I want to talk a little bit more about the other things that you do. So you obviously have your clinical work. You're the CEO of JOWMA. You speak at a lot of conferences. You contribute to Forbes and other magazines. You're also an advocate against anti-Semitism and other things as well. So I guess you kind of touched upon it already, but if you want to share anything else about what motivates you to be involved in so many of these things.
Yeah, so I really consider it an opportunity, and I feel that leadership is important, and it's important to me. Um, and all these different things that I do, I guess, are sort of manifestations of that. I'm certainly learning, can't say yes to everything, which is hard. It's hard to say no to things. But I guess I'm lucky to have, as I do more opportunities. So I've had to learn more recently how to say no to things. And it's something that really comes about, I think, when you have strong opinions. And this is another something that I share a lot with my mentees. If you want to be a leader, you need to have strong opinions on things. And, your earlier question about what are traits that somebody needs to become a doctor? Well, you need the commitment, right? And the follow through and the ability to do well in exams and tough it out and that kind of thing. But ultimately the personality trait that doesn't work as well when you're an attending is often the very thing that you needed to get there, which is following the rules, right? Keeping your head down, not complaining, thinking everything's going to be okay and the powers that be have it all right. And the truth is that kind of attitude can actually hurt you the most once you're done with your training. And I see this a lot, not specifically in JOWMA, just in general in physicians, that there's a lot of discontent and unhappiness when people finish their training and they realize, wait, there's no more gold stars for me to get, right? You're done with all the charts and the exams and the, things that you need to do and people to impress. And all of a sudden you're out there in the big wide world of medicine all alone. And unfortunately, very, very unhappy because you have to decide for yourself what is going to make you happy and what's important to you in your life and your career. So that is not something that you're taught to do in medical school and residency. In fact, it's the opposite. That will get you in a lot of trouble if you start questioning things and answering questions. But those are the same things that will make you happy and fulfilled as a physician. And those are the same things that are required of being a leader. Having strong opinions is a requirement, I believe, of being a leader. And, even if you're at the point in your career where you can't speak up and make a change, you should still know where you stand. And that's another thing that I'm inspired by our members, student doctors like Miriam and Tamar Marmorstein, who are out there combating anti-Semitism, speaking their truth, fighting, whether it's to get clerkship rotations or offer shop. I mean, things that, I would have hesitated to do when I was a student and that I did hesitate to do. And so many of our members are out there saying, no, this is not okay. And again, it's hard in medicine, but that's what makes you a leader. So I think, each person and each physician has to know, again, what's important to them. If leadership is important to you, then do those things and invest time so that you get those opportunities and then you'll be able to get the leadership that you're looking for. But again, it's not important to everyone, and that's okay. For those that are interested, certainly JOWMA is a great place to start because we have so much opportunity and we love to support our members in the projects and initiatives that they want to take on.
Yes, and you guys, again, do a great job with that. And also, I really like your point about knowing where you stand, even if you can't always speak up, because during training, it is a lot of like, just keep your head down and don't rock the boat and just get through with, whatever training you're in. But I think being able to reflect and think about what you actually care about and where you stand on an issue will help you later on when you do need to be able to stand up for whatever those opinions are. So that's a great point.
That's right. That's right. And you can't fix everything, right? Like you can't do everything and also at the same time. So like you said, you have to know where you stand and make a call. Pushing something off for the future as something that you'll want to think about or work on, when you have the time is often the right choice. And this is something we certainly discuss all the time within our members and, mentoring and things like that. Like, when do you speak up? When do you not speak up? These are really important conversations to have. And I think having experience to ask someone else, I mean, again, when I went through my training, we didn't have a JOWMA, but I would speak to my mentors and say, what do you think? Like, my kid is sick and my nanny isn't here. What should I do? And I had mentors who would say, don't tell anyone you're going home because it's your kid. Right. Someone else would say, oh no. Right. And maybe it's different now. Maybe it's not, and maybe that was the right thing to do. Maybe it wasn't. We can debate, but ultimately having someone to ask that question to, is invaluable.
Yeah, absolutely. And I always see the JOWMA chats, there's so much like collegiality in that way. Either it's attendings asking each other for advice or students or people looking for opportunities. And there's always such a like helpful, welcoming response, which I think is really amazing. And I know that I've thought about them many times for things that I needed or, could
Yeah.
recommend to other people. So I think it's a really valuable community.
Yeah. And it's something that we did and continue to do very, very intentionally so that because there are so many doctors who don't have that attitude. I mean, the default in medicine is it's a strict hierarchy, right?
Yeah.
And we very specifically on purpose flatten the hierarchy at JOWMA so that people are encouraged and do, because that's really what our JOWMA members want to do, to support each other. So it doesn't really matter at what point you're up to in your career. You should be able to ask and get help and give help as well.
Yeah, we really appreciate that. And I'll say, especially from like the pre-med and the med student and even residents, like you're so constantly like, at the bottom of the hierarchy, it's very hard to feel like you're able to relate to or talk to attendings or people who are above you. So it's really helpful to have that family feeling. Okay, so a couple more questions. Or what would you say is the most rewarding part of your career overall, if you could pick one thing, and what's the most challenging?
I would say the most rewarding thing is being able to make a difference, being able to cure a patient. People ask me all the time, isn't oncology so sad? And yes,
Yeah,
there are many things that are sad about it, but for the most part, our patients are cured, and that's really, really gratifying.
yeah,
Um,
it's amazing.
being able to help, yeah, being able to help people, being able to see, again, young women like yourself succeed in their careers, like a number of mentees that were pre-med and you know, thinking about dropping out because they were too worried if they would be able to get into medical school or get through it. And, meeting with them, meeting with their spouses, helping
Wow.
to advise them. And then they graduate medical school and they're in residency and they're killing it. They're just doing amazing. So I'm grateful to be able to do all these things and make a real difference in the world.
That's really beautiful.
I mean,
Okay,
I
so
think at some point, and you probably have seen me say this, like it's something I feel strongly about. You know, don't make decisions when you're stressed. Don't make decisions in a time of crisis, right? And it's the best advice. I try to give that advice to myself too, even though I made up the advice. There are so many points in my career where I would have dropped out so many times. Like I've done this exercise before where I go back and I look at my WhatsApp groups with some of my friends and I search like quit. How many times did I say I'm going to quit?
that's funny.
It's it's like
A lot.
more times than I can count, and whether it's kids or family or a stressful situation and we all go through it, like nobody gets through medicine unscathed.
Yeah,
So the fact that I was able to get through, thank God, and to be able to give back to the world, it's a privilege. And I
it
don't
really
I don't
is.
take it lightly.
Completely agree with you. Okay, so for our last question, can you leave us with any piece of advice that you would either give your younger self before you started med school or for anybody who's in that position now?
So I want to actually say, and I've said this before, but you really have to believe in yourself. You really have to know yourself. And it's so hard. It's not easy to do. I think especially as women, we have imposter syndrome, especially coming from the frum community where basically everybody thinks you're crazy. Like, why are you doing this? Like, just do something else, do something
Yeah,
easier. And then you start to question yourself. Why am I doing it? And that just adds on to the fact that it's already hard, even if it didn't come from the background that you come from and have all the obligations that we do. But deep down, you know yourself, you know what you want to do, and no one's going to tell you otherwise. Reinforcing that self identity and that self confidence. It's something I wish I had done more of earlier. And it's something I work on every day. And that I think is so important. It carries you through the hard times and it also carries you through, that plan, whether it's for leadership, whether it's for, the next job or the next opportunity or the next thing that you want to accomplish in your life. And again, your career is part of your life. It's not your life. It's a part of it. So I think that self-identity and self-confidence is something that, we should always continue to work on and to develop those relationships with the people that support you, whoever they are. I'm so grateful to all the people that have my husband, my children, my in-laws, my friends, my parents, people that are there for you, who want to help you, who see your potential, and to spend the time to thank them, to be in touch with them, to talk to them. My favorite thing is to get together with people on Shabbos because, even in residency, because I was free, I was home, right? aside from when I was on call when I was an intern. So really spending time to develop those relationships, because that's what sustains you. And that's ultimately what makes it all worth it.
I agree with that. I think that's actually great advice because sometimes you can feel like it's hard to reach out to mentors or like, you're busy or whatever it is. But I think it's really important to keep those relationships, keep them up because those people do really want to support you and you will do so much better when they're there to support you. So really being involved in that and not feeling embarrassed or shy, you're really
Yeah.
trying to maintain those. And JOWMA is a great place for that as well. So I think that's
Yeah.
a really good advice.
Yeah. And it's, again, it's another thing to do, the things that we don't have time to, but it's so worth it because it's specifically during the time when you're not in a time of crisis that you need to make the time to develop and sustain those relationships that will help you when you are in a time of crisis. I'm not saying to hold back. Obviously, people need help at any time. They should reach out, but it shouldn't only be during times of crisis, right? So you want to make time for your friends, for your family, for your spouse, your mentors, even when you don't have that time of crisis. So, and it's going to be harder, obviously, during different points in your career. As a resident, most people have very, very limited time. But, who lives on your block? Who are the friends that have always, been nice to you and smiled and, you visit them, they visit you. They don't have to be doctors to be part of your community. So many of the people that I'm close to that, again, were there for me when I was in medical school and I'm still close with them. They weren't doctors, right? And I think sometimes women can feel intimidated by maybe someone else being intimidated by them. I mean, you don't know if they are or they aren't. You just think that they might be, right? Because it's such a cliche. But again, it's so, so, so important. So that's my vote as well, to really invest in relationships, because that's really what matters.
Yeah, and that is really the glue that holds you through this entire career path. So it's
Yeah.
extremely important. And the further
Yeah.
along I get, the more that I see that as well.
Yeah. Yeah.
So thank you again. I just want to thank you so much for being here. This was such a fun conversation. I learned so much, and I think it's a really great conversation for people who are, getting into medical school to hear. Thank you so much for being here.
My pleasure. Thanks for having me, and thanks for all you do for JOWMA as a volunteer, for everyone, for inspiring everyone by being a host of the podcast. And I can't wait to see you do amazing things in your career.
Thank you.
Have a great day.
Thank you for listening to the JOWMA podcast. We welcome your feedback and ideas for future episodes. Send us an email at health@jowma.org. Don't forget to subscribe, rate, and review us on your favorite podcast platform.